Hi, everyone. My name is Sierra, and this is my presentation on population level health education intervention for nursing 447. Topics I will be exploring in this presentation are health promotion to prevent the spread of coronavirus or COVID-19 and healthy eating for diabetes mellitus in Latino men aged 18 to 40. So some background and significance. In Escondido, approximately 51.7% of the population is Hispanic/Latino American, and it is an increasing percentage. According to the CDC, compared to non-Hispanic and/or Caucasians, there are 1.9 times more cases of COVID in the Latinos, 2.8 times more hospitalizations, and 2.3 times more deaths in the Latinos. In California, Latinos aged 18 to 34 years old had over 663,000 cases of the coronavirus with 690 deaths. So how does diabetes relate to COVID? Diabetes is one of the major risk factors for either COVID itself or a more severe clinical course and mortality. Latinos are more likely to have type 2 diabetes mellitus at 17%, compared to the non-Hispanic whites at 8%. Over a lifetime, the chances of developing diabetes is 50% higher for Hispanics and are more likely to develop it at a younger age. To bring diabetes and COVID into perspective, by March 28th of 2020, there were 74,000 confirmed COVID cases. Of those, diabetes was reported in 6% of those who were not hospitalized. 24% were hospitalized, but not in an intensive care unit, and 32% of those were admitted to an ICU had diabetes. There's a strong correlation between diabetes and the severity of the course of COVID. It is important for Latinos to improve eating habits to control their diabetes in order to prevent the spread of and transmission of COVID, as well as lessen the severity of COVID if infected. So Healthy People 2020 objectives. Healthy People 2020 provides objectives and goals to meet. For diabetes, the goal is to reduce the burden of diabetes and improve quality of life for all people who have or are at risk for diabetes. The objective for Healthy People 2020 in terms of infectious disease is to reduce the rates of infectious diseases and improve health for people with chronic infections. The Healthy People 2020 objective for vaccinations is to increase vaccination rates. To assess the needs of the community, I conducted a windshield survey within the underserved population. I also obtained interviews with local residents concerning eating habits and COVID. In addition, I was able to interview local nurses and providers to determine what the population and community needs. The theoretical framework and needs assessment. The theoretical framework followed for this project was the pre-seed pro-seed framework. This framework is defined as a framework that provides an 8-phase framework for practitioners to determine, develop, implement, and evaluate health promotion programs, including the application of health promotion theories systematically within such programs. The first 4 phases include social assessment, epidemiological assessment, educational and ecological assessment, and administrative and policy assessment and intervention alignment. Phases 5 through 8 include implementation, process evaluation, impact evaluation, and outcome evaluation. Issues based on education and practice. There are quite a few barriers and issues presented. The major ones are listed here. The different barriers include language barriers such as English versus Spanish, the location of meeting, self-efficacy, health literacy, people not wanting to change their current behaviors. There's a lack of internet or transportation to areas, as well as immigration status. In terms of intervention, the interventions that were focused on diabetes were the explanation of what diabetes is and how it relates to COVID. The intervention to provide knowledge on healthy food choices to promote eating healthy, along with providing educational material to better the quality of life for those who have diabetes. In terms of COVID intervention, there was educational material provided on exactly what is COVID, along with educational material on how to prevent the spread of COVID. Along with that, knowledge was provided on how to obtain a vaccine for COVID and to promote vaccination rates. All of these interventions together focus on the Healthy People 2020 objectives. In terms of budget, the main things that were focused on were transportation. A lot of people were able to use public transportation. However, there would need to be a budget for people who cannot get there to be transported to these clinics, along with access to healthcare facilities and clinics. Luckily in Escondido, there are quite a few healthcare facilities and clinics available. Therefore, there wouldn't be too much of a struggle getting there. Along with vaccines. However, there is free vaccines to certain people despite immigration and insurance. But there should be a little bit more of a budget for this problem. Project evaluation and outcome measurement. My short-term outcomes for healthy eating for diabetes, there were 2 of them. The first one is by the end of the presentation, 50% of the class would be able to name 3 foods that should be reduced that the individual currently eats. The second short-term outcome is by the end of the presentation, the participants will be able to create a healthy eating plan or list that describes healthier foods that patient will eat. By creating this list during our class, those patients will be able to go home and know which foods they like to eat and will continue to eat that are healthy. The next 2 outcomes are short-term outcomes for health promotion for COVID. The first short-term outcome is by the end of the presentation, the participants will be able to state 3 to 5 ways of preventing the spread of COVID. The second outcome is by the end of the presentation, the participants will be able to make an appointment to get their COVID vaccines. For long-term outcomes for healthy eating diabetes, and 3 months after the presentation, diabetic Latino men aged 18 to 40 will have decreased A1C levels less than 8 to reduce the impact of COVID-19 complications. The long-term outcome for health promotion of COVID. In 1 month after the presentation, Latino men aged 18 to 40 will have increased vaccination rates to help prevent the spread and transmission of COVID-19. Results and conclusions. The participants of the class were educated on healthy eating to improve diabetes and health promotion to prevent COVID. The short-term outcomes were all met, which was great. The weaknesses were that were presented were the lack of opportunities for large classes due to COVID. In this clinical setting that I was able to provide the class to only a few amount of Latino men. There was a lack of opportunities due to COVID to present at a larger capacity. There's also a lack of translators available to translate from English to Spanish. In addition, there was also difficulty reaching the community to get them to come to the class. The overall goal for this presentation and project was to promote and enhance the quality of life of individuals who have diabetes and promote health to prevent the spread of COVID. Thank you for listening to my presentation and have a good night.